What's up, everybody? Welcome back to the Move Better channel. I'm your host, Dr. Joe, and this is Jon the Professor Penacerata, and today we're going to be talking to you guys about heel pain. We're doing a follow-up from our last video talking about heel pain and what it could be. Now, if you guys remember, I talked about plantar fasciitis and the ways that we can go ahead and fix that, but we also have two other things that heel pain could be. And that's posterior tib tendonitis, and that's something that a lot of people always say, I have heel pain here, and then they point to the side of their foot, and that's when we start talking about, nope, that's not plantar fasciitis, that's gonna be more of a posterior tib tendonitis, and I'll show you guys today how we assess that and how we're gonna work on fixing that. And then of course, there could also be Achilles tendonitis. Today, we're gonna be focusing on posterior tib tendonitis, and we're gonna see Jon's beautiful feet. Let's get it going. All right, so with posterior tib tendonitis, again, where do you feel the pain whenever you're dealing with some type of injury of this sort? Most people, again, when they say they have heel pain, they start talking about the heel pain right around here, or they'll say, I have plantar fasciitis and I have pain on the medial side of my foot, on the inside part of my arch. And when I tell them, a lot of the time that's not gonna be the symptoms of plantar fasciitis. Plantar fasciitis is going to be more from here to here, and a lot of the times they'll feel it on this side of the heel, and sometimes even at the forefoot, right around the ball of the foot. Whereas posterior tib, we want to check. Again, most of the time there's pain here, but this is the assessment that we normally do. We want to see what the strength of the posterior tib is, and so we bring the foot down. We want to do it in plantar flexion because that's the primary function of the posterior tib, plantar flexion and inversion. So with his toes just like this, we want to check to see how strong that posterior tib is. Now remember, the posterior tib runs right along the posterior tib muscle, or the backside of the tibialis bone, and it's on the inside here. Now, the things that it also could be is it could be a tendonitis of the big toe, the muscles that flex or point the big toe, which is your FHL and your FDL. We won't get too much into anatomy there, but with the tendonitis of what we are checking for is how do we fix this type of pain on the inside part of our foot. And so I'm just going to check first to see his strength. And all I'm going to see is, does it hurt? Is there weakness? Is there compensation? And if there's compensation, we're going to see his whole body start to try to get some work done in order to increase that strength. So let's go ahead and check it out. So when I do it, I'm going to hold his heel and I'm going to pull, hold your foot, keep me from pushing. And notice his big toe. Now, if I see some compensation, I'm going to see his big toe flex even harder here. And we're going to see if there's any type of pain. And if there's some weakness, let's pretend if there's weakness there and he goes, ow, then we know that it's going to be a dysfunction or a weakness of the posterior tib. And when you have a tendonitis, like I said before, almost all tendonitis or tendinosis, we also almost have to go into the pain in order to fix it. And when we have a tendonitis, we kind of lose function or control over that area, where we call proprioception. When we lose proprioception, we start utilizing compensation muscles to help with the strength. So in his case, we're going to check, see if it kind of breaks down, if he starts to utilize other muscle groups, and that's when we have to go ahead and start working on fixing it. So let's work on fixing it. So we know it's going to be a posterior tib tendonitis, but we also know that there are other muscle groups that help along with it. So it could be the flexor muscles of the big toe, which if you notice that your foot collapses and you start noticing that you start to have a drop within that arch, you're going to start dealing with some pain in this area, and your big toe is going to have a lot to do with it also. So what we're going to have to do is we're going to have to create a self-massage release for it, and we just have to utilize a softball, a baseball, or a lacrosse ball, whatever you have. That's something that's pretty hard, and then you're going to put it on the muscles itself. And so the first place that we're going to start is not on the arch. We're going to start right on the inside part of the tibia, or the medial part of your calf. So we're going to place pressure on his calf just like this, And all he's gonna do is just leave that pressure. Now remember, you don't have to roll up and down. In trigger point therapy, we're just gonna find that tender spot and we're just gonna leave pressure on there. And in his case, we could leave it on there for about 30 to 60 seconds, sometimes even 90 if it feels that good. Cool? So we're gonna hold it on there, and then if you would like to, you don't have to, you can go up and down and you can find that one spot and you can just kind of pump it there and release that tension. And that feels pretty good. Another thing that you could do is, instead of leaving it there, instead of rolling up and down, you could just pin and point, rotate. There you go. Do whatever you need to do with that foot, and that can start helping to release all the different fibers, try to get the fascia and the muscle to kind of glide over each other as he's putting pressure into his posterior tib. Now, a lot of the time, what I have my patients do is they're normally sitting down. And in his case, just for the camera reasons, we're gonna have him laying down. Now remember, you can still do it in this position as well. We're gonna get the inside part of that arch, the painful side, and we're just gonna keep pressure on there. You remember, you don't have to push so hard. All you're trying to do is wake up the muscles, wake up that communication pathway between the muscle and your brain. And you're just trying to find a way to self-soothe, self-massage. You're keeping that pressure there, and then you're just lifting the big toe, pointing the big toe, and you can use your foot too. So you don't just have to use your toes. You can use your whole ankle complex to release tension of that medial side of the foot. So for the stretching side of this, I utilize a wedge or a slant board that can help with increasing some stretch to his calves. And for people who have heel pain or are runners and they need some stretching with their calves, a slant board you can find on Amazon. There are also other devices that you can utilize. There are rocking devices, some stretching devices for the calf, soleus, Achilles, as well as the foot. This arch support, or this slant board that we're gonna put down, we're gonna be focusing on trying to stretch the soleus, the calf, the gastroc, and then our focus again is gonna be on the medial border of the tib. And so in order to stretch that out, he needs to push that way as well as lean on the middle part of his foot. And that's all he's simply gonna do. It's as simple as just trying to stretch your calves out. You don't have to have a slant board. You could put your foot on a step, on a stairwell, or on anything that's gonna be able to elevate the forefoot. And then as you can see here, he's gonna stretch, but he's also trying to lean on the inside part to where he's trying to get a little bit of a deeper stretch onto this. Now, we don't wanna stretch there too long, but we also wanna try to activate it. So he's gonna sit there for about 4 or 5 seconds, and then he's gonna lift his heel up, and then he's gonna drop it right back down. And we wanna be a little bit more dynamic with this. I don't wanna sit there for too long because again, my goal here is to try to activate the muscle and then go right back up. And right now we're just trying to do a little bit of some lengthening techniques to increase that communication pathway to the brain. Go ahead and relax. So similar to Achilles tendonitis, what we're gonna do here is he's on a different slant board. Again, you guys can utilize a step or anything that's a curb. You guys can utilize anything that you guys need in order to be able to get your heels off of the floor. Now, what I wanna do is I wanna make sure that when he does a raise, go ahead and lift your heels up. So when I have him raise up, I wanna make sure that he's putting pressure into his big toes right over here. And notice his heels are already going outward, right? And so what I wanna do is I'm gonna make sure that he's utilizing the muscles of the big toe. And sometimes it's the FHL and the FDL. They come underneath the arch here and they go into the soleus right over here. So what I wanna do is I'm gonna have this little brick here. Go ahead and push your heel into that. That's gonna help work on working on that posterior tib as well as the big toes. And now, just like in an eccentric heel drop, we're just having him isometrically hold, and then he's gonna decelerate slowly his heels to the floor. Bring it back up fast, hold it right there, and then again, slowly on the way back down. And he's gonna do a little bit of a burnout on this. Now the key is to make sure that you don't overdo it, because if you overdo it, you're gonna feel pretty damn sore. You don't wanna feel too sore when you're doing all of this. You're just trying to activate the muscles. And all I'm gonna have him do here is 1 set of 10 repetitions. And I'm gonna have him walk it off right after. We're gonna do 1 more rep right here. We're gonna pretend we just did 10, and we're gonna come right back up, hold it right here, and then he's gonna slowly bring it right back down. Go ahead and relax. All right, you guys, try those exercises out. Let's see how they help you. If there were some concerns, some questions about some of the stuff that we went over today, let us know down in the comment section below. Share, like, subscribe, let people know about our channel so that way we can help more people, all of your friends and family. Thanks again for joining us, you guys. We'll see you guys on the next episode.